Hey there, chiropractors. Do you want to know the single most important key to building a practice that stands out massively in your community, generates endless results, and also keeps patients and their entire family coming back for years on end? It all hinges on one thing: extraordinary, world-class clinical results. Everything starts there, everything begins there, and everything stays there. That is the number one thing that obviously patients expect when they're calling and coming in. Nobody comes into a chiropractor, nobody comes into a healthcare facility and is like, we'll see how the results are. They demand the results to be there. High level, world-class clinical results is the one thing that no one can skip over. You can't market past this. You can't script past this. You can't systemize past this. And in fact, the practices who are entirely dependent upon running ads, doing screenings, and making it cheap and easy to get in the front door are the ones who are not good enough clinically to generate this level of results, to generate that many referrals, and to keep patients coming around with their entire kids and family for a lifetime because they don't get results. So I mean it. Everything hinges on this one thing: getting extraordinary results. I knew that, thankfully, starting out in my practice. I've had the most incredible chiropractic adjusting ninja wizard mentors, people by the name of Dr. Mike Cody and Dr. David Fletcher and Dr. Rick Burns and Dr. Rick Elbert. These are people that were so essential to my formative years learning how to be a chiropractor. And the best sequence of training starts with this, because if you skip this, how to get extraordinary clinical results, and we're going to break it down to its nuts and bolts here in a second, well, then the rest of it isn't going to work as well. We're going to have to work overtime to overcome, and you can't. You really can't overcome craptastic clinical results. Take it from me. This is what legendary practices are built on. I have become a world-class marketer, communicator, leader, and business owner because we first committed to world-class clinical results with kids, pregnant moms, full families, and even the toughest cases, which is actually going to be my tip number 3 and strategy number 3 in this video. So let me get started with number 1. All right, the first thing I have to teach you into how to get extraordinary clinical results in a family practice, and this one to me should seem painfully obvious, but when I expose it, you're going to be like, dang, I'm doing this. So no judgment, just support and strategy to get to the other side of it. You cannot one size fits all everyone clinically. You can't expect the same technique to work for every single patient and every single subluxation pattern and clinical type, and you absolutely positively cannot give the same care plan to everyone. But here's the problem. None of us are really taught care planning. None of us are really taught case management, especially when it comes to kids and families. So the second tip I have for you is literally the one that unlocks everything. And it's so obvious. It's so important. And yet so many of us, the majority of us, absolutely suck at this when it comes to kids, families, and actually doing this in a nervous system focused, subluxation based principled way. Care planning. Most of us are taught to care plan in one of 3 ways. So if we break down strategy number 2, how to get extraordinary clinical results, it's not on the power of the adjustment, singular. It is completely up to the adjustments, plural, on the right frequency, intensity, and duration. That's called neuroplasticity, and that's called a care plan when it comes to looking at our practice. And there's 3 ways to build a care plan, and I'll do another video about this another day, but hear this one inside this one. Number 1, you don't. You just do the weak, watered down way. I took 2 different pediatric certifications and nobody taught me how to care plan. We all were just told, start 2 times a week and then tell them, see how it goes. See how it goes? These are parents putting their child's health into my hands, literally, and they're going to have me guess on the care plan. And then here's what see how it goes means. You start to back off care when the symptoms get better. Oh, just caught you on that one, didn't I? By the way, this isn't your fault. You weren't taught how to actually do that until you get exposed to these videos and our content and we get you over this hump. But the truth is, that's awful. That's medical. So that's option number 1. Don't take that option. Option number 2 is you just give everybody a year-long care plan. This is the practice management coaching scripted way. Everybody gets this 36 visits, everybody gets 54 visits, everybody gets 12 months of visits, and it's all on the same frequency and the same, and you just regurgitate it. You might even have your staff do this report of findings or do it in a group setting. Now, that's not chiropractic done with excellence either, because everybody has a different case history. Everybody has a different nervous system and subluxation pattern, and my God almighty, this one's also obvious. To think that the same care plan is going to get extraordinary world-class results for every single patient is just horrendous application of chiropractic. Option number 3 is everybody gets a personalized, customized care plan based upon exactly what levels of stress, dysfunction, and subluxation their nervous system indicates by your deep dive into their case history and your examination, your neurologically focused subluxation-based examination. If you don't know how to do option 3, stick with me in this content channel. However you're finding this or wherever you're exposed to us, stay with us because you need that to get extraordinary clinical results because they are more based upon the care plan and getting that right than your technique, your table, or your technology. And you want to talk about the real separator, the third thing I'll leave you with on how to get extraordinary clinical results. Step into the space of taking on tough cases. When you tackle tough cases, autism, epilepsy, cerebral palsy, just chronic autoimmune conditions in adults, and POTS and PANDAS and Lymes and you name it, when you step into the toughest of cases, you become a world-class neurologically focused family chiropractor because these patients require you to get better. They require you to study subluxation even further. They require you to hone your craft and your care planning and your adjusting even more. Right now, today, as I make this video and share it with this incredible profession I love, I am taking on tougher cases than I ever have. We have patients coming to our clinic from internationally. The last 3 new patients I onboarded were from Scotland, England, and Ireland. Evidently, across the Atlantic is where our material, our content is really reaching right now for patients. And we've seen them from South Africa and Mexico and all over the place. Why are they coming to our practice with the toughest of cases? Because seeing them locally over the years has lovingly, awesomely forced us to get better clinically. We now take on cases that are ridiculously tough and probably overwhelming to the majority of chiropractors every single day. It's what we do. We've trained ourselves. We've leveled ourselves up. We've stepped into this clinical excellence at a level that most chiropractors have not yet. And that has absolutely exploded our entire family practice. Because when you are internationally recognized, or even let's just say within the county or within the state and within your region for taking on tough cases, what do you think that does to the rest of your brand and your marketing and your referrals and your recognition? Everybody wants to get chiropractic care at the clinic that has patients coming from across the world. Word gets out digitally, word gets out locally, and when you take on the toughest of cases, I'm telling you, and the reason I put this third is it's kind of like that extra credit cheat code that maybe not everyone is willing to do, but those that are will never, ever have a new patient problem and have the practice truly of their dreams, not just with tough cases, but filled with entire families as well. Really lean in and take on the toughest nervous system focused cases out there in your community, and it will pull you and it will push you and it will awesomely force you to become a legendary world-class chiropractic wizard is my favorite way to say it. And this world, which has more stress and more chronic illness and more tough cases than ever, your town, your country, my country, they need that from us. So many more of us need to stop doing the same thing for everyone like every other chiropractor does and step into this space of clinical excellence. And if you need our help doing it, simple call to action at the end of this one, subscribe. Stay connected to us here on YouTube, Facebook, wherever you found this video. Make sure you very actively, intentionally follow us and soak up every bit of content because this is the sort of content we make. We will speak right to the heart of challenges in real life practice because we're in it every day with you, and then we'll bring you the real life solutions and strategies to get to the other side of those challenges because that's also what we do every day in practice. If you love this one, give it a like, give it a love, give it a comment, give it a share. We love you. We'll see you on the next one.